Good morning. Well, thank you, Professor Kenny. I really enjoyed the illustration of the doll that you had there, the doll with the placenta and the umbilical cord. I think that plus a cell phone would be really beautiful. But that's the artist in me responding. As artists, what we do, we take, oftentimes we take objects and make them much bigger or much smaller than they really are, and bam, they turn into art. So we're very good at changing the scale of things, making things very large, very small. When we look at large problems, oftentimes we find ourselves overwhelmed and disaffected because we think we can't actually solve the problem on our own. So games are a wonderful device to change the scale of a problem, to make it from a very large problem to a very small problem, one that is actually manageable and that gives us positive feedback loops. Climate change and air quality are major challenges that we're facing today. The medical component ranges from general life expectancy to particulate matter in the lungs to asthma, all these things. I'm not an expert on that, but I am interested in scaling the problem down to a scale that is actionable. And so to do that and to make a game, we have to do several things. We have to break the problem down, and we have to create a character for it. And so here's my pollution character that I developed together with students at UC Berkeley. And this pollution character is the embodiment of pollution itself. So it's kind of hanging in there, and it's kind of sneering at us and say, haha, you think you can get me, right? And it has lots of eyes, and the eyes function as indicators for sensors, for levels of pollution on a sensor that we designed. We all agree, it seems, that games are a great way to interact, and also we all agree that the kind of feedback loops that games provide are very effective for engaging patients in their own health care. But the real question that I'm pursuing with this project that I ran into while I did this project was, where is the boundary between funny and serious? Games are supposed to be funny, right? But healthcare is very, very serious. So how do we negotiate that boundary? And I have some examples I'd like to show you. So here's the serious part, and somehow the patient, the situation there with the X's, just ignore the email up there, the address. I got an email recently from a person that I don't know who found our work online and said, I linked your site via a website called Apartment Therapy. I live in Golden, Colorado. There's a Coors brewery right next to my house, is what she says. And it says, any help you can offer would be greatly appreciated by myself and my mom's group, which has a lot of very young children living within a mile of Coors, the brewery. So she's concerned that the brewery produces pollution, and she smells it with her nose, and she maybe imagines that it's there, but she doesn't know. So typically, the problem is very large scale. Air Now might come in and do a study on Colorado once in a decade, or there might be a sensor somewhere in Colorado that tells us about the air quality, and the density of the sensor network simply isn't high enough. So it's very hard for individuals to have a feeling that their specific home and their specific life experience is being adequately monitored by the government. So people like Ariel here contact me and say, can I get one of your sensors to put in my home to find out what the level of pollution is? And this is what the sensor looks like. This is in our Berkeley Institute of Design. We're testing a sensor here. The sensor has 5 parameters. We're testing the bottommost parameter, which is volatile organic compounds. Here we're using a marker, a dry erase marker, to test volatile organic compounds. But of course, next to the Coors brewery, there would be all sorts of different components floating around in the air that would be responding, that would cause the sensor to respond. This is what our website looks like. It's a site with lots of little images of where the sensors are. There's sensors all across the nation. There's some in New York, some in Washington State, some in Los Angeles. There's going to be one in Colorado shortly. And there's even one right here, actually. This is the Berkeley Institute of Design up there, and we moved the sensor from there to here for yesterday and today to see what the air quality is like in this very room. Now, this is very funny because we placed the sensor in this room, and I looked at the data last night. Around midnight, this room was 40 degrees Celsius. And I was like, wow, what is going on? There's some really hot party happening here. And we don't know about it. We weren't invited. What's going on? And this morning I came and I found the sensor was actually sitting on top of the radiator. So I realized, aha, it really matters where you put these sensors. So what we did is we moved the sensor, and since you might be interested in monitoring air quality in your house, and since this is a game, I am going to offer the first person who finds the sensor in this building, it's moved from there, it's now somewhere else, the opportunity to take the sensor home. So the first person to find it and to tell me I found it will be able to take the sensor home for 2 months and run it wherever they want and participate in this network. So that's the game part, is to find the sensor and to take it home. That's how it works. Now, what are we measuring? We're measuring light. This is one channel of light that we're measuring, because light is a very important aspect of pollution. If things are dim and cloudy, and it's a serious indicator, like the haze of pollution, haze of smog. In 1904, the first incident of pollution that's recorded in Los Angeles was recorded as a sudden solar eclipse. People were in Los Angeles in 1904, and they walked around, and suddenly around noon, the sky went dark, and they thought there was a solar eclipse, but it turns out it was just pollution concentrated from industry. So this is an old problem that we've dealt with for a long time. So light is one indicator. Another indicator that we're measuring is temperature, and this again is outdoor temperature before we had outdoor light. Outdoor temperature goes up and down a nice day and night cycle. Here we have a sensor in Zellerbach Hall, which is a concert hall next door here. And when they rehearse, you see the noise levels go up dramatically. Noise is another important factor of well-being, I think. It causes stress. Here is another channel we monitor, which is carbon dioxide. And you see this is a gallery in Los Angeles, and when they have public events or openings, their carbon dioxide shoots way up to 5,000 parts per million. The average is somehow down here around 300 parts per million. Carbon dioxide. Here is a sensor in a neurobiology lab, and so here are the weekends. You see the weekends, nobody goes in. And here we have the weekdays, and each weekday around 10 a.m. they clean the lab, and so there's spikes from volatile organic compounds, and they disinfect things, and that's what we see there. And here the range is again between 0 and 5,000 parts per million, and we're going up and down between, maybe a percentage of 5,000. So this would be 15%. This would be 5% of 5,000 parts per million. And if we put it all together, we get a pretty dense picture of what life is like in a particular place and what kind of pollution we experience. Here again is the neurobiology lab, and this is Professor John Flannery's lab. And we see light going up and down during the day, but every day at midnight there's a spike of light. And I was like, what's that all about? Well, it turns out there's probably a security guard checking the lab, right? So we see all these little things that we didn't even think about recording, and we get a really nice picture of what the environment is like there. And we see really dramatic spikes in carbon dioxide and volatile organic compounds happening at the same time. So if it's healthy all the time, I'm not sure, but I can see that overnight it regenerates, it cleans up, and then during the day it continues again. So, of course, the other thing to do is to compare levels from location to location, and that's one thing we haven't quite implemented yet, but we're working on it. So you can now just open 2 windows and compare your home to somebody else's home and see, well, why am I not living in Whidbey Island, which is in Washington, which is way out. It's a beautiful forested area, and there's a sensor out there right now, and we see really low and really sort of calm volatile organic compounds, and compare that to the lab there. There's a lot more going on. So this really is a much better place to live than your average lab, I guess. But you can't get as much done. So what are we after? We're after a transformative effect. What happens is people take these sensors home, and they have this little face, they have this character, and this character becomes their pet. Just bring this up. It becomes their pet. They look at it every day. They look at it like we look at a clock at home, perhaps, and say, oh, yeah, it's time to do this, time to do that. Well, more and more we organize our life around pollution, and we think, oh, it's time to put the cap on the marker because it's getting kind of smelly in here. And so it becomes like a pet that we start talking to or interacting with every day. And it has what I would like to call a transformative effect. And that's what we're always looking for when we design games. Playing a game changes the person so that when the game is over, the person is a different one. And we hope that the transformative effect is a shift to the better. And so if we design a successful game, that shift is permanent. And if it's not successful, the shift is either negative in the wrong direction or it's not permanent. So the transformative effect is to move our participants in this game from the status quo to the transformation. And the status quo is things like pollution is ubiquitous, it's too big for one person alone to solve, I can't do anything on my own. and to see, oh, actually, if I scale the problem down, I clean up my home or I clean up my office, I can put plants in my office, I can put better ventilation in, I can do all these things to improve the quality in my area of influence. One thing we found when we ran this project in Los Angeles is that a lot of people really don't own their environment. They really have no control over where they live and what pollution they're facing, and that's really sad. But they realize that they don't have control and then try and do something about it. Like people don't own their workplaces or don't have enough authority to change their workplaces, and then this empowerment becomes more difficult. But the transformation is very effective. People become able to talk to others about their experiences. They have this yes we can feeling. They're now empowered and they're no longer disaffected. So that's a very important transformation. And we simply do that because we bring the sensor to the home and we scale it down to a daily problem, a problem that can be interacted. Here's a picture of a sensor. You see it up there. That's how they hide in places. In a laundromat where there's a bunch of threads, I guess, for fixing things, in a dry cleaning store. And this man here, he decided to turn on the fan in his laundry store 24 hours a day instead of only when he's actually there, because he found that there's a buildup of volatile organic compounds in the night. So when he walks into his shop every morning, he's engulfed by these fumes, and he didn't realize why that was. And I told him, well, just leave the sensor in there for another month and turn on the air conditioning all the time and the ventilation all the time, and you'll see an improvement. I have one more minute. Here are my conclusions briefly. So with games, we can scale things, complex dynamics, down to interactive, personal, daily experiences which players can take action. The scale changes are temporal, spatial, and also in terms of complexity. Temporal has a lot to do with feedback. Games give us feedback every minute or every split second even, and that's very important. A doctor's visit happens every 2 weeks, maybe, I don't know, every month, every year, and so the feedback rate is not high enough. With games, we can include the feedback rate dramatically. Games create ways to talk about things. They make us more media savvy. They make us more able to navigate complex sets of information. And so we change culture with games. And community, also games allow individuals to engage with each other through competitively, collaboratively, or pedagogically across great distances. And the important part is here, the pedagogically. This means that people can actually teach each other how to play games. And if I have a game that's really cool, you might see me play it, and I show you how to do it. And that kind of teacher-student effect is very important at propagating games and building community around a game. Lastly, Balanced Game is a game we're working on with Dr. Randy Hagerman in UC Davis at the Mind Institute. This is addressing Fragile X patients and helps them train their sense of balance. The Wii Fit was mentioned. This thing was designed a year before the Wii Fit, but we didn't patent it, so there it goes. So what do? We just come up with a new idea. So Black Cloud I talked about extensively. Balanced Game I mentioned briefly. One thing that's very interesting to us right now is that we're working with multiple object tracking tasks in a very simple game to try and do early screening for autism and for Fragile X in underserved communities in West Oakland, and we're very excited about this study. It's very interesting to put a game that runs all the time into a room with children that play all the time, and because the game records its results constantly, we can see how many kids in that population are learning to use the game better and how many kids are not doing so well, and maybe like that we can screen for various issues that would go undetected until much later and would complicate therapy thereafter because they went undetected. Thank you very much.